has certainly grown for facial rejuvenation from doing nothing all the way to facelifts. And most of us in our private practice start getting involved with facial rejuvenation with the skincare products and doing mild skin changes to chemical peels and then lasers, then from lasers bumping up with different procedures until we end up doing a facelift. And one of the nicer things about the newer laser procedures, unlike the older laser procedures, is that the older laser resurfacing procedures like a CO2 laser was a very ablative procedure where we did a lot of damage, and the problem is there was a tremendous vast downtime for anywhere between 3 to 5 weeks depending on the person, because they peel, they turn bright red like tomatoes, and then 3 weeks later they turn pink, and then there's a question of when they feel comfortable going out in the public. The technology is such that now we can use CO2 lasers, but more in a fractionated fashion, or even an erbium laser, which is a non-ablative laser, to try to get improvement of skin by decreasing the amount of wrinkles and getting the skin tightening. And one of the lasers we started working is a fractionated CO2, which really is like a mini blast of the old-fashioned CO2 laser that we used to use 10, 12 years ago. The nice thing about that laser is it doesn't hit every single solitary cell, but it hits maybe every other cell. And by doing that, it leaves healthy tissue next to the damaged tissue, so your rate of recovery is much improved, it's much faster. The downtime is anywhere between 3 to 5 days. You see the change probably about a week. There's minimal pain, there's minimal downtime. It's a short surgical procedure. It's certainly less expensive than a facelift per se. And again, this procedure won't give you a facelift result, but will certainly make your skin and your face look much more rejuvenated and healthy than if you did nothing alone. So I've asked 2 of my patients to talk briefly about their laser experience, and I hope you enjoy that. Thank you very much. And what we're doing now first is we're cleansing our skin of the topical laser we did to kind of numb up the skin, so that when we do the procedure, she's numbed and ready to go, but we want to cleanse the skin. Just finished what we did. Was that as uncomfortable, as bad as you thought it was going to be?
I didn't know what it would feel like.
Did it? Okay. Was it on a scale from 0 to 10, where 10 is really horrible, painful,
yeah,
and 0 is like nothing? Where would you say we were here? 3, 4 maybe?
Yeah. 4.
2, 3 maybe?
Yeah. 4 at times.
Okay.
Sometimes 3.
Okay. Well, thank you very much. You were terrific.
Thank you.
Thank you. This is Kim. It's another one of our lovely patients. We have a little different skin type, so we're going to probably increase the power settings a little bit to give a little bit deeper peel, or actually laser, than we did in the previous patient. And you can see her, she's got a little more skin damage, sun damage, compared to the patient we just operated on. Okay, thanks. What you may or may not be able to see is I've lasered this side, and look, you can see the improvement in skin texture versus this side. Look at these large wrinkles over there. And now, remember, she had the same thing on the other side. It's smoothed out. So she should have a really wonderful result. And was it that bad?
No, it wasn't.
Oh, good. Okay. Okay, if you had a scale from 0 to 10, where 10 is the worst, where do you think we had you?
On the pain level?
Yeah.
I would say
4?
about a 4 or 5.
Great. Okay, thank you. We're all done. It's now an hour after we finish your laser, maybe an hour and a half after yours. You guys feel pretty good, right?
Yeah.
You can see there's a little bit difference in the 2 gals, because her skin was a little bit deeper, a little bit more sun damage than this lady. But all in all, was it comfortable? I mean, I know it's going to be a little uncomfortable because it's a procedure, there's some heat.
Right.
Wasn't bad, right?
Oh no, it wasn't bad.
All right,
And,
terrific.
Already the pain is almost gone.
That's pretty good.
Yeah.
And otherwise, the settings are pretty much the same. We
Right.
didn't do little stuff on you. We went pretty deep into the dermis for what we
Right.
were looking for.
Right.
We went a little bit deeper with you because of the dark
Right.
discoloration of your skin
And more
the face.
lines.
More lines, and the reason why you have a little bit of the punctate bleeding that you're seeing has to do with the fact that when we get a little bit deeper into the dermis, that's where the blood supply is.
Okay.
You're going to be fine, but
Okay.
that's, if we didn't get some of that, we kind of wonder where our depth of where we're going.
Oh. Hello.
Thanks for coming in today.
Dr. Berman.
We wanted to have a conversation a little bit about what you had done and how you feel about what we took care of for you. So,
As promised, there was stinging, a little bit of, you know, burning kind of thing, but the good thing afterwards was that it went away within a half hour, which was really wonderful. And the products that we were given after the, prior to the procedure, the products that we were told to use, all worked beautifully. The moisturizer, and then afterwards, it took maybe about 5 days before I looked really good. And I think you have to remember that my skin, according to the doctor, was thicker, so I had kind of a deeper procedure, I think, than
That's true.
than others would have.
I had thought about it for a long time and decided to go ahead. I did not want to do surgery at this time, and I was extremely pleased with how quickly I recovered. I was able to go back to work within 5 days. So immediately post-op, it was cleansing your face a couple of times a day with a special solution and adding creams, and that is essentially what it did. I did everything around the house, and that because I didn't go out for about 5 days, that I wanted to do. I felt fine. Then after that particular period of time, we used the lotions and creams given to us by Jessica, which have done a wonderful job. People have said that I look rested. They don't know what happened, but they're saying I look rested. I think my skin looks similar to maybe 15, 20 years ago. And in that respect, I think it was well worth the time.
great.